Hi, I'm Dr. Valerie Masuda. I'm a palliative care physician, and welcome to Tea with Val. Today, we're talking about constipation. Constipation is a horrible condition to have, and a lot of people that suffer from lack of energy, for example, or life-limiting illness have problems with constipation. A lot of times, medications that you may take for pain or shortness of breath cause constipation. Sometimes even medications you take for nausea can cause constipation. So basically, your stomach, this is my little bowel model, but your stomach produces a lot of fluid as well as the rest of your gut. Where the stomach finally releases into the small bowel, the fluid goes with it. And then you digest that food, and the gut basically squishes, like a toothpaste tube, the food down like this. This is called peristalsis. That's a fancy word. And as the food goes down and is digested, the water is absorbed from this food because a lot of water goes in to help with digestion. So at the end, hopefully, your gut has been acting very well, and at the end you have stool, which is soft, easy to pass. However, if you are taking a medication or your guts are just really tired and they go very slowly, what happens is more and more water is absorbed from the gut, and that stool becomes dry, becomes hard, and it's difficult to move through the gut and difficult to pass. So we have different kinds of strategies to deal with constipation. One thing we have is something called Restoralax or polyethylene glycol, also called Laxaday. It's by many different names, but it is a clear substance. Usually comes with a little cap, but usually fill a cap with this. You add it to water, juice, milk, and it dissolves into clear, colorless, and tasteless substance. What this is a complex sugar that stays in the gut. So as the stool goes down through the gut, the water doesn't get all absorbed. It stays in the bowel and keeps the bowel hydrated and moisturized and soft. So this is in fact a stool softener. It works better than other kinds of stool softeners that you may find on the market. This is probably the best one. You can take a full glass once a day, and if you really have stubborn bowels, you can take 1 glass up to 3 times a day. And if taking a full glass is just hard on your stomach, you just feel too overwhelmed by drinking that much fluid, you can just sip it as it goes. So that's Restoralax. The other thing is lactulose. This is an orange syrup, and it is quite difficult for many people to manage. It's very sweet, and it works the same. It's a complex sugar. It stays in the gut. It keeps the fluid in the gut, but it also stimulates the bowels. So people may find that the use of lactulose, a tablespoon or 2, can keep their bowels going, but they may find they may get diarrhea with it. If they're too aggressive, they may also get gas, cramping. But lactulose is covered under most provincial drug plans. And some people take 1 or 2 teaspoons or tablespoons every day in order to keep their bowels managed. It's important to be proactive with your bowels and not to wait until you've not had a bowel movement for 3 or 4 or 5 or 10 days, because then it becomes a big problem. The other thing we use is this substance called Senokot. It is a ground up product of seneseed, and this stimulates the bowel. Prunes also stimulate the bowel, or prune juice. Often when you're taking medications that really slow the bowel down, then what you need is something to counteract that by speeding the bowel up. And so agents like Senokot can do that. Some people take 1 tablet once a day. Some people take 1 tablet twice a day. You can take up to 3 tablets twice a day. Some people use Metamucil to keep their bowels going. Metamucil is a complex fiber. It's a soluble fiber. You mix it with water and you drink it. The problem is, though, if you're getting constipated because you're not drinking enough fluid or your bowels are going very slow, what happens is the Metamucil itself can get very, very hard, and it actually can cause constipation in people who are struggling with life-limiting illness, who are on medications that slow the bowel down. So I usually recommend not to use Metamucil. Some people have had problems with constipation for a long time, and they may find they have to go to the bathroom suddenly all the time, passing diarrhea, loose stools, or watery stools. And often there's incontinence associated with that, leaking stool. This is not diarrhea. It's actually something what we call overflow incontinence, where there's so much stuck in the bowel, the only thing that can come through is very soft or liquid stool, and often associated with incontinence. If you're experiencing this, it would be important to see a doctor or a medical personnel just to see what is going on with your bowel. Certainly, if you have bad abdominal pain, if you have nausea or vomiting associated with abdominal pain, and you haven't had a bowel movement, or you're very bloated, you need to seek medical advice immediately, and this may be through your local emergency department. So when we talk about constipation, this is kind of the place that people spend a lot of time in. If you feel you've done a lot of laxative care and you feel there's fullness down below, it could mean that you need a suppository. So this is a suppository. You can find bisacodyl or glycerin suppositories, little bullet shape, and you peel them off, and this little bullet is inside. The idea is to use a finger and then take the suppository and then push it into the rectum like this, and then to hold it in there for 10 to 15 minutes. What that does is it stimulates the rectum to just release the stool, and so you should feel urgency and then to be able to pass stool. Now, one thing you should consider if your energy is low, or if you have problems because you have a rectal cancer, or you can have hemorrhoids, or you can have a small tear which is very painful, so you can consider a bidet toilet seat. These are toilet seats that you can purchase, and they replace your normal toilet seat. However, there's a reservoir for warm water, and the remote control controls the water, so you can get a spray of water in the area that you want to clean. It also requires a power outlet, and it plumbs directly into your toilet. This is an easy thing to do yourself, or you can hire a plumber, but I would highly recommend the use of a bidet toilet seat. You can have less expensive models that don't heat the water, but again provide a very good cleaning function. If you've tried all these things, Restoralax, Senecot, you've tried increasing your fluids, and you're still not having any success, and you've tried a suppository, I would say it's time to see a doctor or a nurse to do a full evaluation to see, is there a blockage? Is there a reason why you're unable to have a bowel movement? Thank you for joining me for this edition of Tea with Val. If you found this video helpful, please share. You can also find our other helpful videos at www.satacenter.com.